You might be wondering, can ketamine therapy actually make PTSD worse? If so, you're watching the right video today. I'm going to discuss ketamine therapy's role in the treatment of PTSD, how ketamine therapy can make PTSD worse, and what other treatment options exist for PTSD. Hey, I'm Dr. Ko from Reset Ketamine in Palm Springs, and in today's video, I will explain how ketamine therapy can both help and in some cases worsen PTSD symptoms. I'll also share an emerging treatment for PTSD that I'm very excited about. So let's dive in. Let's first start off with what is ketamine's role in the treatment of PTSD? Well, there's a growing body of research supporting the role of ketamine for PTSD treatment. One exciting study by Dr. Fetter and her colleagues, published in the American Journal of Psychiatry in January 2021, examined patients with chronic PTSD on average for about 15 years. Many participants in that study had tried various antidepressants and other medications with little success. So the researchers took a group of 30 people and randomly assigned them to either receive IV ketamine or IV midazolam, which is a medication used as a, quote, active placebo to mimic some psychoactive effects without actually treating their PTSD. The participants received 6 treatments over a 2-week period. What were the results? Well, patients who received IV ketamine experienced an average 50% reduction in PTSD symptoms. Not only that, but those patients who also had depression alongside PTSD saw a reduction in their depression symptoms as well. Importantly, the study reported no serious adverse effects in that IV ketamine group. What makes this study so important? It is the first randomized double-blinded trial comparing IV ketamine to an active placebo specifically for post-traumatic stress disorder. In previous studies by Dr. Fetter, they had only tested a single ketamine infusion, whereas in this study, they evaluated a series of 6 treatments, which is a protocol that is commonly used in the clinical setting today. So what can we take away from this study? Repeated IV ketamine infusions over 2 weeks may be an effective and rapid treatment for PTSD symptoms. We know that PTSD can be incredibly difficult to treat, and this research shows that ketamine therapy offers a promising option. Now, what does randomized double-blinded even mean, and why is that important? For those unfamiliar with it, randomized double-blinded studies are among the most rigorous types of research. Randomized means participants are randomly assigned to receive either ketamine or placebo, so they don't know. Double-blinded means that neither the participants nor the researchers knew who received which treatment until the study is fully completed. This is important because this type of study reduces biases and ensures that results are as objective as possible, making the findings much more reliable. Now, for the question that probably led you to this video, can ketamine therapy make PTSD symptoms even worse? Well, the answer is yes, it is possible. Ketamine can induce altered states of consciousness. Dr. Eli Culp categorized ketamine experiences into 4 types. Number 1, the empathogenic experience, which is feelings of comfort, relaxation, reduced ego defenses, and increased empathy. Number 2, out-of-body experiences, a sensation of detachment from one's body, diminished ego defenses, and even encounters with non-terrestrial beings. Number 3, the near-death experience, which is a psychological death of the self, a life review with moral reflection, and a sensation of existing purely as consciousness. And number 4, ego-dissolving transcendental experiences, which is a feeling of unity with the universe, transcending time and space. Now, imagine experiencing an out-of-body experience or near-death experience unexpectedly, especially if you have a history of PTSD. Well, if someone is not prepared for these intense experiences, they could potentially be re-traumatizing, especially if they bring up memories of some traumatic events. So what makes ketamine therapy safe and effective? Well, the key factor in ketamine therapy is readiness, willingness, and setting. If a person doesn't want the treatment, or if they're not prepared for this mind-altering experience, it can be overwhelming or even traumatizing rather than healing. Ketamine may even bring up repressed memories, and for someone who is not emotionally prepared, this can be pretty distressing. Having a support system, including preparation before treatment, integration afterwards, can make a world of difference. And this is why Mental and physical preparation is crucial before starting ketamine therapy, and having a trained professional to help integrate the experience afterwards can turn a challenging experience into a transformative one. For some people, ketamine therapy may not be the right fit, and whether it's due to a personal preference or medical contraindication, this is where the stellate ganglion block comes in. SGB is a non-mind altering treatment for PTSD that really offers an alternative to ketamine therapy, or even in conjunction with ketamine therapy. So what exactly is the stellate ganglion block? It's an outpatient procedure where there's a local anesthetic. It's injected near the stellate ganglion, which is a cluster of nerves that plays a role in the body's stress response. The procedure takes about 30 to 45 minutes, and really the goal is to reset the body's fight or flight physical response, which can help alleviate PTSD symptoms. The stellate ganglion block has been around for over a century now for chronic pain, and in recent years, we've actually discovered that it can benefit for those with PTSD symptoms and other mood disorders. Studies and patient experiences suggest that some people will experience significant relief from PTSD symptoms with just a single treatment. So if ketamine therapy isn't the right fit for you, the stellate ganglion block, SGB, may be a great alternative to consider. So let's recap. Ketamine therapy has been shown to be a rapid and effective treatment for PTSD backed by strong research. However, ketamine therapy is not for everyone. If someone's not prepared for the experience, it can potentially be re-traumatizing rather than healing. Mental preparation and support are critical for a successful ketamine experience. Now, for those looking for a non-mind altering option, stellate ganglion blocks provides a promising alternative for PTSD treatment. I hope this video helped answer your question. If you found this information useful, be sure to hit the like and subscribe button. Thanks for watching, and I will see you in the next video.